Hi, welcome to the Blue Technique section. This is the beginner level. Let's follow Melissa as she demonstrates the exercises for us. For this program, you're going to need a heating pad or a warm, moist towel. This will help in the stretching program during our main shoulder rehab program. You will also need a broomstick or a cane to help in stretching, and you'll need a comfortable surface to lie down on, like a carpeted floor or an exercise mat. Please wear appropriate clothing and appropriate athletic footwear. During this program, you may experience some slight discomfort around the shoulder. This can be normal. If at any time, though, during the program, you experience increasing discomfort, please stop what you're doing. Review the technique. If pain does persist, please stop the exercise and consult with your physician. The exercise strengthening portion of this technique section involves performing exercises that are called isometrics. These are exercises designed to strengthen our shoulder with little or no joint motion. They are intended for individuals who have a painful or stiff joint. Let's begin with some gentle stretches. For the purpose of this video, we're going to concentrate on the injured or painful arm to be the right arm. The first stretching exercise is the supine forward flexion. Lying on your back, holding the stick in both hands, shoulder width apart, slowly bring the stick directly over your head. Reach back gently until a stretch is felt. You will hold this position for 15 seconds and bring the stick down. This is referred to as an active assisted stretch. The good arm is doing most of the work while the injured or painful shoulder is going along for the ride. Let's do that again. The next exercise is the supine external rotation stretch. Again, lying on your back, holding the stick in both hands, cupping the injured right side on the end of the stick. Your elbow is bent at 90 degrees. You will keep your elbow close to your body and use your good hand and stick to push your injured, the right arm, out towards the floor until a stretch is felt. You're going to hold this for 15 seconds and then return to the starting position. Okay, let's try this one again. Rotate the arm out until a stretch is felt. You will hold that for 15 seconds and bring that back. The next stretch is the supine internal rotation. Again, lying on your back, place the palm of your injured hand down next to your buttocks region. Now attempt to gently pull your hand up your lower back. When a stretch is felt in the front of the shoulder, hold that position and attempt and try to press that injured shoulder back down onto the ground. This is how you maximize this stretch. Don't go any higher, just maintain that position and hold for 15 seconds, and then you will go back to the starting position. Okay, let's try that again. Slide the hand up the lower back until the stretch is felt, and then try using the muscles of your upper shoulder to bring the shoulder back down onto the ground. You will hold this for 15 seconds, and then you will return to the starting position. The next stretching exercise is the supine abduction. Again, remaining on your back, holding the stick in both hands, you will cup the injured hand around the end of the stick. Using your good arm and keeping that right injured arm straight, you will push your arm away from your body, holding it close to the floor. You will bring this to a point where a gentle stretch is felt. You will hold this for 15 seconds and bring it back down. Okay, let's try that one together again. Bring it back up. Hold that position for 15 seconds and bring it back down. Let's continue with the blue strengthening technique section. Again, these series of exercises are called isometrics. They help strengthen our shoulder muscles with little or no joint motion. Okay, let's start with the first exercise, the isometric forward flexion. In the standing position, utilizing your opposite hand or wall for resistance, keep your injured elbow at your side bent to 90 degrees. Try and push that injured arm forward, but resist that motion with the good arm. You will hold this position for a count of 5, and then you will relax. Okay, let's do that one together again. Bring the arm up, gently push forward, resist that motion with the good arm. You'll hold for a count of 5 and then relax. The next exercise is the isometric external rotation. Again, in the standing position, utilizing your opposite hand or wall for resistance, keep your injured elbow at your side bent to 90 degrees. Now try and rotate that hand and arm outwards away from your body. Again, you will resist that motion with the good arm. You will hold this for a count of 5 and then you will relax. Okay, let's try that again. Bring the arm up, gently try to rotate outwards, but resist with the opposite arm. You will hold for a count of 5 and then relax. The next exercise is the isometric internal rotation. Again, in the same position, you will use your good arm to resist rotating the injured arm inward towards your body. You will hold this for a count of 5 and then you will relax. Okay, let's try that one again together. Bring the arm up to 90 degrees, rotate it towards your body, keeping your elbow at your side, and resist that motion with the good arm. You will hold this for a count of 5 and then relax. The next exercise is the isometric abduction. In the standing position with your arm straight at its side, you will resist lifting that arm away from your body, again, utilizing the good arm to resist that motion. You will hold for a count of 5 and then you will relax. Okay, let's do that again together. Lift the arm away from the body and resist that motion. Again, trying to keep your shoulder at a nice level position. Okay, let's relax. The next exercise and our last strengthening exercise is the isometric extension. In the position with your elbow at your side bent to 90 degrees, utilizing your good arm cupped underneath your elbow, you will try and push your elbow backwards. You will hold this position and resist that motion for a count of 5. Okay, let's relax. Let's try that position again. Arm bent to 90 degrees. You will hold and resist that backwards motion of your elbow. You will hold that for a count of 5 and then relax. We have completed the stretching and strengthening technique section. If necessary, please review these exercises until you feel comfortable with the technique. You may then go to the main rehab program and begin. If you would like to strengthen your uninjured shoulder, we recommend that you repeat these exercises for the good arm, but may also use one of the other programs for strengthening. Please review those exercises for your good shoulder.